This webinar is an overview, understanding Huntington's disease. So what we wanted to cover today is what is Huntington's disease, some of the key symptoms, and then strategies that might help in your caring role. So what is Huntington's disease? So it's a hereditary neurological disorder. So hereditary means it's been passed down within families, and neurological means that it affects the brain. So that puts it into the same group as other conditions such as multiple sclerosis and Parkinson's disease. And the disease is named after George Huntington. So he described it among residents of East Hampton, Long Island, New York in 1872. George was a physician, as was his father and his grandfather. And they worked in the same family practice. And it was by seeing these families over time that George was able to describe not only the symptoms, but also realize that it was a genetic disease. Symptoms of the disease normally start between the ages of 30 and 50, but they can start a lot younger. We do have some children who have the disease, and that's known as juvenile Huntington's disease. And the symptoms might also start a lot later in life, and that seems to be becoming more common as with other conditions such as dementia and Alzheimer's. So in terms of statistics, there's around 1 in 10,000 people have the Huntington's gene, and that's around 8,000 people in the UK, or just under 7,000 people in England. And if you compare that to other conditions, multiple sclerosis, you're looking at 90,000 people. Parkinson's disease, you're looking at 121,000 people. So it is a rare condition. And also, we have the people who are symptomatic, but we also have around 32,000 people at risk of the disease at any one time. So what are the symptoms and how can you help? So when we talk about symptoms, we talk about 3 main areas, and we group these because it makes it easier to talk about the symptoms in this way. So we talk about physical symptoms, we talk about thinking symptoms, and we talk about mood symptoms. And these very much interact with each other. You might hear them called slightly different names as well. So thinking symptoms might sometimes be known as cognitive symptoms, for example, but they tend to be grouped into these 3 categories. So there is a general pattern in the progression of the disease, but people with Huntington's are individuals, and there's a huge variation in the symptoms that people experience. So some people might experience a lot of physical symptoms and less mood symptoms, other people in a different way. And the severity of those symptoms is different. So there's no 2 people with Huntington's who will present in the same way, but there's common themes that we know of, which mean that we can look at some strategies which might be suitable for most people. So when we talk about the physical changes, the first thing that we often notice about people is the change to movements. So it's the involuntary movements that we notice, and those are the ones that people, they don't want to make them, and those are known as chorea, and those movements are very much out of the individual's control. So as we said, everyone's different. Some people have extreme chorea and other people have none at all. Chorea can be helped with medication, but there are side effects associated with that. So a neurologist will always look at, are these movements causing a problem to the person themselves? And if not, would we try to treat them? And how do we manage that treatment? The other issue with movement is around voluntary movements. So those are the ones that the person wants to make. And they're sometimes more subtle, you might not notice them, but actually might be more of a struggle for the person with Huntington's. So what we're looking at in the early stages is the really fine motor skills, so issues with handwriting or doing up buttons, etc. And it's a movement that they want to make, but sometimes it doesn't quite happen how they wanted it to. So someone might go to put down a cup, and actually it becomes that they're slamming it down on the table rather than gently placing it down, or they go to shut a door and it slams shut, but that's sort of a movement that they've tried to create. It just hasn't quite worked how they planned. So then we think about changes to speech. So that often starts with sort of a slight slurring of words or a struggle to manage the volume of speech. And over time, speech gets more difficult, and it's really important to focus on communication strategies and how we manage our communication to make life as easy as possible for the person with Huntington's disease. A speech and language therapist can also be involved from the early stages to advise on exercises and things which might help, or helping someone to maybe slow down in their speech so they can help the person with Huntington's disease, but also the carer. In terms of swallow, this is a common problem, and in the early stages you might just notice that someone's coughing a little bit while they're eating, or something's changed a little bit, and this is also a really important time to get a speech and language therapist involved to get that support from an early stage. When we talk about weight loss, most people with Huntington's disease do lose weight. And actually, the more people can maintain the weight, it tends to be the better that other symptoms can be. So it's really important that we try and keep up weight where possible. And a dietitian is the person who would be able to support with this. Now, we've got incontinence there, and we've got that with a question mark. And the reason for that is that sometimes people can appear to be incontinent, but there's other reasons behind it. So it might actually be that they couldn't quite manage to undo the clothing in time, or it might be that they are very apathetic in nature, they've lost that get up and go, and they just don't manage to get to the loo in time. So what we would say, especially in the early stages, is to always try and get that investigated. So we've mentioned a few therapists there. So in terms of movements, you might look towards a physiotherapist, you might look towards an occupational therapist. We've talked about speech and language therapist and dietitian. So these should be accessible through your GP. So it's really important to involve people as soon as needed. Now, this is a range of guides that we have for families. So these are all available through our website, and are really worth a look if these are some issues that are concerning you at the moment. So the three on the left, so it's behaviour, but it's linked with communication, the communication there, linking in with the eating well, and then our advice on equipment. And then on the right-hand side, what we've got there is some guides which are available on our website. So it's a physical activity workbook. So this is for someone who's thinking that they would like to be more physically active, and thinking about maybe a way to go about that if you're caring for someone with Huntington's. And below that, what you can see is a clip, but so this actually is from an exercise video that again we have available. So these are things to have a look at and see if they might be relevant for the person that you care for, and in ways of sort of working with them as a carer. In addition to that, we do have a wide range of professional guides. So the one on the right is for GP. That is one of our guides. I would certainly suggest that if you're seeing a GP and your GP hasn't seen this before, to pass this on. They're unlikely to have met many people with Huntington's in their career, and this will be certainly a helpful point for them to try and work with you. In addition, the European Huntington's Disease Network produces a range of clinical guidelines or clinical tips for different therapists. And these, again, are the sorts of things to think about. If you're working with these therapists, or if you're going for the first time, for example, to see a physiotherapist, they will be very grateful for this, because they work with a wide range of people, and they might not have worked with someone with Huntington's before. So these will empower them to do their job. So we're moving on to thinking changes. So when we talk about thinking changes, or try and empathize with the person with Huntington's and what they're experiencing, it's really useful to think about the brain in a pretty basic way. So we know that different parts of our brain do different things and have different roles. And the middle part of the brain is a bit like an air traffic controller. So it's that central control that's sending messages out to other parts of the brain that we can think of as the pilots. And if the air traffic controller isn't working, then the pilots can't do their job. So it's this part of the brain that organizes the way you think and the way you retrieve information. And this is the main part that isn't working as well as it used to for people with Huntington's. And that helps us slightly with working out what our strategies can be to try and support someone. So because that bit isn't working and those messages aren't getting through like they used to, what we find is people with Huntington's tend to think slower. So sometimes you really need to wait for an answer. It might be that you ask a question and it's just taking longer for that process to work, for that message to get through and for them to retrieve that information. So you might have to wait a few seconds for an answer, or even a minute for an answer, maybe even longer. And this is quite challenging because this isn't the way we're used to communicating. We tend to go backwards and forwards quite quickly. So it's something that we need to take into control, and you might need to sort of let people know about that if they're speaking to the person you care for, because actually if they interrupt that thought process, then you might lose out on getting an answer altogether. People with Huntington's often get stuck on one idea. So it might be, for example, that there's a clinic appointment tomorrow, and that might just take over everything. And this can be very, very hard for carers. And if you're caring for a distance, this might mean that you're getting numerous phone calls in a day, because it's just an idea that the person can't get out of their head, and they're worried about that coming up. So that's quite a common issue, is just really getting stuck. People also really struggle with multitasking, so not being able to do more than one thing at a time. You can see this in a number of ways, but it might be walking and talking is quite a common thing that we see. So actually, if someone's walking, then actually trying to have a conversation at the same time can be a real distraction. Or if someone's eating, then chatting at the same time can be a distraction. And actually that's when you might start to see some issues with the swallow, so a cough or something like that, that things aren't quite going down the right way because they're trying to multitask. People with Huntington's tend to struggle with making choices. So if you ask someone what do they want for dinner, it kind of feels like a bit of an overwhelming task to really try and retrieve that information. So we'll look at ways to make that easier. And also, people really struggle to wait for something. So if you've said that you'll put a cup of tea on and then you've gone to do something else in the interim, then actually that can be really hard for someone to wait, and it sort of ties in with that getting stuck on one idea. And we just made a note of this at the bottom, just to be aware, this might be true of the person you care for, or it might not, but sometimes people with Huntington's just really don't recognize that they have these symptoms. So some people don't really recognize they have Huntington's at all, and other people sort of recognize they do, but they don't see these changes in themselves. And in many conditions, that sort of reaction might be seen as kind of a denial and a coping mechanism, which can have a place in Huntington's, but it's often part of the disease. So that bit of the brain that should be sort of saying, yes, something's not quite how it used to be, is actually damaged, and therefore they're not recognizing the symptoms. And that can certainly be a challenge in terms of getting the appropriate support for people. So how can we help? So in a basic way, we have to think back to that picture of the air traffic controller, and we need to become the air traffic controller. So we need to be the one who's actually supporting someone to be the motivator and to put that structure in place for them. So a calm environment makes a huge difference. So one thing at a time. If the television's on and it's their favorite TV program, that's not the best time to have a conversation. Or if you're eating, think, is the radio on at the same time? Is that an issue? Or actually, if the family's chatting at the table, is it better that there's a bit more silence at the table while you're eating and a chat afterwards? So these can be difficult things to modify because it can be quite different to the way that we're used to sort of coming together as a family. Having a set routine. So people tend to like the same things happening at the same time, and actually we all do. So we kind of like the pattern that we leave to go to work and that we come home at a similar time every day and we have our dinner at a similar time. Not many people like it if that's sort of completely thrown out of sync, especially if it's out of your own control. And for people with Huntington's, that's even more so. So it might well be that if you're a full-time carer, and especially if you're an older carer, both of you may have given up work and you might have lost a lot of the routine that was in your life and the predictability. So it might be worth looking at how you go back to having more predictability in your life. And as a sort of tool you can use, you might even have kind of some sort of diary up or a whiteboard with what you're doing each day or your daily routine. And you might have that close to a clock so that you can actually have something that actually, if the person with Huntington's is starting to think, I don't know what's happening today, you've got that there at all times. So giving plenty of time, so it takes longer to answer a question, so it makes sense to leave more time for that answer, but it might be leaving more time for lots of things that you're doing. If you know it takes a long time to get ready for a clinic appointment, then just factoring that into your day. And then we talk about reducing choice to give choice. So actually a lot of time we think that sort of having lots of choice is empowering for people, but for people with Huntington's where they really struggle to make choices, actually it can be overwhelming. So this is really about sort of gauging the level that the person you're caring for can cope with. So if you're going to ask a question like, what do you want for dinner? That might be too hard. But if you're saying, do you want fish or sausages tonight? Then that might be sort of easier for them to make a choice. Or it might be that actually you take the stress out of it completely and you say, oh, we're having fish for dinner tonight. Another thing that sometimes you see with people is the response to everything is no. And that might be a no because they don't want to do something, but it also might be a no because it's easier to do that than try and think of an answer. So if you've said to someone, oh, I fancy a walk today, where would you like to go? Would you like to go? Then actually the no might be the easiest thing they can come up with. Whereas if you sort of say, come on, let's get your coat, we'll go to the cafe in the park, you might get a better response. So it comes back to you being the motivator on behalf of that person. So the behaviour and communication guide we mentioned earlier, so it combines the two. So this really does go through a lot of behavioural issues. And so I would definitely recommend a read of that if there's any of these that you're struggling with. So we'll move on to mood changes. So there are changes in the brain that might mean that someone's personality and their mood are affected. But what it's useful to think about is actually, as a starting point, what makes us become agitated and upset? What affects anyone? And actually, this is a little diagram that kind of goes through quite a few things which actually mean that we're not performing at our peak. So if we're hungry or thirsty or in pain, we're not really on good form normally. We're a little bit under par. If we're too hot or too cold, then actually, yeah, we're sometimes just not that great. But what we tend to do is we can often recognize that these things are happening and we can do something about it. So we can take a painkiller, we can go and have a drink. Sometimes we do it a bit too late. Certainly, sort of, people often find they're dehydrated and then realize they feel quite a bit better after they've sort of done something about that. Someone with Huntington's is likely to be the same, but might not recognize that they've got these issues, and that it might sort of make them more agitated than it would with other people. So things like this, it's thinking about, is the person I care for, are they having regular drinks? It's really important for everyone to stay hydrated. Are they hungry? So people with Huntington's tend to need more calories than other people. So often you're looking at sort of 3 main meals during the day, but then snacks in between. And asking someone, are they in pain? Or if communication is a real challenge, it might be actually, if you really think someone's in pain, sort of give someone a painkiller and just see if that makes a difference. That's obviously something that you could talk to a GP or a doctor about as well. And recognizing actually if it's a bit hot in the room and you're sort of taking your own jumper off, actually is the person you care for sort of got a lot of layers of clothing on, and so just sort of prompting them, are you feeling a bit too hot at the moment? So other things in there, so we've talked about having to wait, so this can make people be really agitated. Social embarrassment, so some people might be upset if they're sort of out and about and they're behaving slightly differently. So some people will be unaware, some people will be absolutely fine with it, it doesn't bother them, and for other people it might be a bit upsetting, and it's trying to sort of find ways around that. So if it's someone who's had a fall and actually they were a bit embarrassed because they had a fall, but also it might have made them a bit nervous that they might fall again, then actually maybe a trip to see the physiotherapist to look at some sort of balance exercises, but also looking at their footwear, so looking for solutions based on what the issue is. We've put sort of staff and residents in there, so if the person you care for is in residential care, then actually this can make a big difference. Often people will have some staff they really like and some that they don't like, and likewise with residents. And it's just the way we interact with people generally that some people will rub people up the wrong way. But if you're not sure why someone's upset, that could be something that's causing it. If we're tired, we tend to be more easily agitated if things change. And also this one at the bottom, perhaps one of the most important ones is, has someone got an infection or is there another illness going on? So actually if someone goes downhill quite suddenly, it's really important to sort of go and see the GP and check, is there any sign of urine infection or chest infection? And those things will have an impact, and the person might not be able to tell you that they're sort of feeling a bit under par with an illness. So because of these sort of mood and personality changes, you often find that people struggle to control their emotions and sort of lose their social filter. So that's a sense that actually if any of us are feeling a bit grumpy, then we can still probably go to work and hold it together and not sort of let our upset be known with our team, or certainly not with our boss. However, if we're at home, that might be a time when we sort of just let things out and have a moan and a bit of a scream about things. So we've got a social filter of kind of deciding what behaviour is appropriate for what situation, and often that's lost in Huntington's disease. And fitting in with that is the ability to read other people's emotions. And you might well see this as a carer, that actually you've had a bad day. It would be clear to most people that you're struggling a bit and you need a little bit of help yourself, or to be cut a little bit of slack, and that might just not be something that's noticed by the person you care for, and that can be pretty tough. People do get scared about situations. So actually residential homes, that different staff, the different residents or upcoming appointments, and also people might well be anxious or depressed. Now, if this is sort of clinical anxiety or depression, then it's obviously very important to get that addressed. The ideal situation is that people are under the care of a specialist clinic where they're seeing a specialist in Huntington's disease. So this is certainly something that they would be asking questions about, and it's also something that you can see your GP about. But anxiety and depression are very common in the general public, and someone with Huntington's would be treated in a similar way, and treatment can often have quite good results. So it is something to get addressed, and may well have an impact on other behaviour generally. People are probably quicker to become more frustrated, more irritable and angry. So that's thinking about some of those things on that diagram that might cause that. And many people say that actually the person they're caring for is behaving differently to how they used to. And so it's trying to sort of manage some of the challenging behaviours in some of the strategies that we will look at. So how can we help with these sort of mood changes and when people become agitated? Well, the first thing is making thinking easier. So these are the things that we talked about earlier. So it's having that calm environment, the routine, limiting choice, etc. That takes some of that cognitive load off people, those thinking challenges, and just actually makes life a little bit easier. But the other thing that is a really good thing to do is to try and find out what is triggering this behavior. So we talked about those triggers. There might be many more, but it can be hard to do that if just on a day-to-day basis you're sort of noticing things, but you're sort of not keeping any record. So one strategy is to use a behavioral diary. So what that entails is, you can just do this on a simple piece of paper, but put down the date, record if something happens, if someone got upset, if they got agitated, and then really think about what happened in the run up to that. So was there something different in the day? Had someone different been to visit? If you've got carers coming in, and which carer was with them at the same time? Was it just before dinner? So were they a bit hungry? So trying to sort of pinpoint, okay, what's causing this, is useful to record then what happened, and also if something was put in place which made things better, because then you can sort of use that at a later date, or if there's a few people involved in someone's care, it's really good to kind of swap those strategies. So actually if you know that you sort of spot that actually someone's getting a bit upset or agitated at sort of 11:30 every day and dinner's at 12:30, then actually do you want to add an extra snack into the morning and see if that can help. And so obviously, as discussed, medication is available for anxiety and depression, and getting care from your specialist clinic if it's available is probably one of the best things that you can do. So in terms of support for professionals, again, there's this GP guide, and that does have a lot of the medication listed in there. And also, if things are more challenging and there's questions around sort of mental illness and also around capacity, so if someone's able to make decisions themselves or not, then we also have a guide for mental health workers. So these are aimed at professionals. They're freely available from our website, or we can post these out to people, and you're very welcome to read them yourself, but also to hand them on to professionals or point them in the right direction. So moving on to sort of a bit more problem solving and looking towards sort of a carer's toolkit. So this is a problem solving strategy, and it's using what we call the 5 A's. Now this is from a chap called Jimmy Pollard, who is an American, and he was a nurse working with a lot of people with Huntington's, and he wrote a book called Hurry Up and Wait. It's actually an excellent book which I would very much recommend. He has a huge amount of strategies in there, but this is one that can often work quite well for people. And what he says is, if you can start with your first A, which is anticipate, and you can work out what the issue is, whether that's using a behavioral diary or just keeping an eye on things, then actually you can look towards either allowing or accommodating or adapting or arranging, so that we can minimize the impact of that situation. So to talk through that, so looking at allowing first. So actually, do we look at the behavior and allow someone to behave in that way? So if you have anticipated that you've got a family gathering coming up and 10 people are coming, and you actually recognize that this is probably going to be pretty tough for the person you care for because it was last time, then actually, do you allow them to be there for part of it, just be there when a few people are there, or not be there at all. So what's going to work best for them in that situation? So what do we allow to make that situation a simpler one? Then accommodate is similar to allow, but sort of with certain circumstances. So this might be where the behaviour is having an impact on other people. So, for example, it might be that someone's playing really loud music. That's sort of their enjoyment and what they want to do. And actually, it can't happen all the time because it's disturbing the neighbours, but it can happen when they're out at work. So from 8 till 6, okay, you can play this pretty loud, but after that, if you want it, you'll have to listen with your headphones, or we cut it off at that time. So adapting, so we can think about adapting your communication, or the way you do things, or potentially using adaptive equipment. And then the final one, arrange. So can we arrange something to make it easier? So if someone's struggling to get dressed in the morning, it might be that that's a physical challenge, but it might be that it's just a bit overwhelming to open the wardrobe and try and find what they need, because actually you've got to take into account what's the weather like that day, where are you going that day, what goes together, what's comfy. So there's lots of things to take into account, whereas if you actually can just pile up some clothes in advance, that might be sort of a setup where it sort of allows the person more independence, but you've just arranged things to make things a little bit simpler. So this is an example that is given to us from one of the families we work with, and he was happy for us to share this for training. So he says, "My wife has driven me mad over the years by demanding cups of tea after the cafe is shut and refusing to believe it's closing time. And she also refuses to leave until all the tea's finished. So obviously this is a bit of a challenge because you've got a cafe that needs to shut. They can't just remain open, but he also wants his wife to have that enjoyment of popping in for a cup of tea on the way home from a trip out somewhere, and it's something they enjoy doing together." So the way he managed that was he sort of certain specific cafes they use, and they know them quite well. And when he goes in, he'll just mention, "Can we have a special pot of tea?" And actually what they then know is just to give him a half full teapot. It means that they're done by closing, and actually his wife has enjoyed that trip out, and there hasn't been sort of a situation where she's got agitated, and things have remained calm. So in terms of a carer's toolkit, it's really important to look after yourself, and we're very aware that is much easier said than done, because life is busy and life is complicated and life is taken up by your caring responsibilities and probably many other responsibilities that you have. But if you're not looking after yourself, then you're not going to really be in the right place to look after the person you're caring for. So we do say, see your GP, let your GP know that you're a carer. There might be simple things that they can do. It might be that you get the flu jab every year so that you know that you're protected. Look after yourself in terms of preparing for emergencies. So setting up a plan, which might be through your local carers group or through the council, so that if something does happen to you, you have a plan for what will happen for the person you care for, and taking that pressure off yourself if you sort of worry about that scenario. And also looking after your own well-being, so your physical health generally, your mental well-being, and that's something that we're in the process of creating a guide on, and we'll share that sort of when that's available, just to see if there's one thing that you can do to help yourself, whether it's just going out for a walk for 10 minutes at lunchtime to get some fresh air, but sometimes little things like that are hard to carve out but do make a difference. Talking to other carers, so you might already be part of a Huntington's Disease Association group, branch or support group, that those are opportunities to speak to people face to face who might have gone through similar things. They might have strategies that they can share, or it might be just people you can talk honestly and openly with, who aren't going to judge you because they understand what you're going through. If you're not part of a group and would like to be, then do contact us, and we'll see if there's one local in your area. And also most carers groups, most carer charities locally will have carers groups. So obviously there you'd sort of be with a group of carers all caring for people with different conditions. But again, it's that space to sort of have a safe space to share experiences. We also have online support. So we have our message board, and we have started a specific online space for older carers, which you're very welcome to join. And just let me know if you'd like more information. So adapting your communication, perhaps one of the most important things that you can do to support the person you're caring for. So if you haven't read that communication guide before, maybe download that and see if there's any tips you can pick up. And likewise, if you're having particular challenges with sort of agitation, think about doing a behaviour diary, and maybe think if those 5 A's can fit in somewhere, and maybe think about reading through the behaviour guide, Jimmy Pollard's guide, and as it says on that last tick point, sort of just look at what resources are out there, or ask us if you're not sure. So in terms of the support that we can offer at the Huntington's Disease Association, we have a specialist advisory service. If you don't know your advisor already, contact us and we'll let you know who they are. So that would be an advisor covering your area. As I've said, we have our website where all these resources are, but we're also happy to post them out. We have the message board, and also if you've got younger people in the family, we do have a youth engagement service, and that means that they can sort of get support which is specific for them, and can be a place for them to sort of voice the things that are concerning them and learn more about the condition. But sometimes it's nice to have that sort of separation within the family. So adults are getting support from the advisory service and children from the youth engagement service. So just another reminder of our pop-in cafe, as this is a new thing which is funded through the same pot of funding as this webinar. It's something that we're really keen for people to join, and that this is we are soon to launch specific web pages for older carers. I'm sure that the content on there will be very relevant to all carers, so keep your eyes on social media, and we will be letting you know once that is launched. And in terms of social media, these are our social media sites that we have. So Facebook being the most popular, but closely followed by Instagram. So if you're not on those, then please do take a look if that's something that interests you.